Good afternoon, North Dakota, and happy Easter, happy Good Friday to everyone. As we enter this holiday weekend, this is an opportunity for us to reflect on all the blessings that we have as North Dakotans. It's an opportunity to renew our faith, and it's an opportunity to strengthen our connection with our families and friends, even as we might have to do that remotely. We know that today, Good Friday, is an important day for many North Dakotans, and the billions of people around the world that celebrate Easter. So it's appropriate today that we'll begin with a prayer from Lieutenant Colonel John Weimer, who's the state staff chaplain for the North Dakota National Guard. And of course, as Lieutenant Colonel Weimer comes up here, we also say thank you to all of those National Guardsmen who have always served our state with distinction and continue to do so during this health emergency. Lieutenant Colonel.
Feel free to join me as I pray. Almighty God, we come to you on this Good Friday, still a state holiday here in North Dakota, and still a day when many of us are mindful of the suffering and death of Jesus Christ. As we come to a holiday when many people travel and connect with family, we are mindful of how different our lives are this year. I ask that you help us be patient with the changes in many areas of our life and help us to see how important our actions are for the good of our community. We lift up to you all those who are personally struggling with COVID-19, whether they're in the hospital or at home, and we lift up to you all those working on the front lines of this battle as they work long days and weeks. We are grateful to you for your presence and strength and ask for your blessing on the people of the great state of North Dakota and the United States. In Jesus' name, amen.
Thank you, Lieutenant Colonel. We're grateful for your service, and we're grateful for all of the faith-based leaders across the state of North Dakota who are working and innovating to work with their congregations these past few weeks and this weekend. We know that health of individuals is related to spiritual health, for sure, and spiritual health supports mental health, supports resilience, supports community. And we want to, again, thank these leaders because so many of them have found creative ways to hold worship services while still adhering to social distancing guidelines, whether those are virtual services on social media. We've even heard of parking lot services where people stay in their cars but tune into the same radio frequency to hear the pastor. As we head into this weekend, we know that not just that our nation was founded on freedom of religion, but actually when we think about the earliest settlers that arrived in the 1600s from Europe came to America even before there was a United States, and they came here for reasons of religious freedom. So we know this is a deep foundation in our country, but even with that religious freedom, we urge people to continue to follow the CDC guidance and not gather this weekend in groups of 10 or more. And if you do, maintain social distancing. This is, of course, a voluntary guidance, not an order, but we are aware that there have been breakouts that have been traced back to congregations. And given that demographically, a lot of the people that would traditionally attend on Easter include our elderly in the state, we want to, again, make sure that we're protecting them. So again, we congratulate and share our gratitude with all of those faith-based leaders that have found ways to continue to look after the spiritual health of their congregation, but do that in a way where during this time when we have a contagious and deadly disease that we can protect those lives of North Dakotans. At the same time we practice great spiritual health, we can be practicing great physical health. We know that switching to the Easter holiday, we also know that there's other traditions that go with it, depending your family. Many times this does mean traveling and being with relatives, being together as family, particularly in a multi-generational way. We know that that's going to be hard on both young kids and on grandparents because this is a deep time of connection. And so again, our empathy goes out for those families that will be physically separated this weekend, but know that as we've said, your sacrifice by not being together may, in fact, save the lives of your loved ones. And so we appreciate all that you're doing in exercising that individual responsibility among families, particularly across generations. We also know that among many in our state, there are certain traditions that go along with Easter, including the Easter egg hunts. Typically there's even an Easter egg hunt here at the Capitol, which of course is not happening this weekend. But we do have some good news for those people that are focused on Easter egg hunts, because today I did sign a proclamation declaring the Easter Bunny as an essential worker. And so that the Easter Bunny, along with other magical creatures, including the Tooth Fairy, in case you eat too much candy, Easter candy this weekend, and you have a tooth that comes out, the Tooth Fairy is also an essential worker, and so both of those are relieved. So again, I won't read the whole proclamation, it'll be online, but now therefore as Governor of the State of North Dakota to hereby proclaim that the Easter Bunny, the Tooth Fairy, and other magical creatures are deemed essential workers in the state of North Dakota, so long as they follow ND SMART guidelines while carrying out their critical work. So that's signed and posted as of today. So thank you to the Easter Bunny. And for our diligent and practicing safe spacing media team that's been here, each of you at your desk, more than 6 feet apart, you'll find an Easter basket for you. And I guess it's really not a basket, it's an Easter brown bag. But thank you again to the media that's been coming here, and we wish you and all of the people in our state a happy Easter. Getting into the case numbers for today, we've got some good news and some sad news. The good news right off the top is 9 positives reported out of another great testing day, 618 tests that were completed through the labs across the state. That's a 1.5% positive rate. That's less than half of what are been trending on the 7-week average. That's one of the numbers we really pay attention to see if the curve is climbing in North Dakota. And it's not. It's actually adding in that 1.5 for today has dropped us down to a 2.9% 7-day rolling average, and that's we get to 2.9 based on, again, the tests of the last week. So that's all the positive news that's in there. That's great news. We did report yesterday that there was a death that wasn't in yesterday's number, a man in his 70s from Stark County with underlying health conditions. That is in today's number. That's what moves us up to 6. But there's sadly, since this morning's 11 o'clock report, we have to report another death in our state. That would bring tomorrow's total to 7, but we're unable to share details at this time, any specifics, but we do know that it was a woman in her 70s with underlying health conditions acquired through community spread, but no more details pending notification of family. Again, Catherine and I extend our deepest condolences to the family members, particularly on this holiday weekend, who've lost a loved one to the deadly COVID-19 disease. We want to also really highlight another important thing. On the bottom of that page that we've got the 9 numbers on is the number 13. That is the number of people currently hospitalized. That number is down, but it was down from 14 to 13 for the wrong reason. It was because that represents the individual in Stark County who we mentioned yesterday was hospitalized and that passed away, but it does still reflect the current number of hospital beds in the state of North Dakota that are utilized by people with COVID-19 disease. But again, the math that we want to focus on, people are paying a lot of attention to, are we going to have enough hospital capacity? It's one of the things we're working diligently as a state. Next week you'll hear more about our surge capacity planning, but again, that we are almost couldn't be further away from needing Tier 3 surge capacity, because those 13 hospital beds today represent less than 1% of the hospital beds in our state. It's really probably less than 0.5% of the beds in the state. So we are, another way of saying this is 99% of the hospital capacity is available. And again, we appreciate all of those providers out there that have, many of them have voluntarily stopped doing elective surgery. They've drawn down their occupancy counts in preparation for the potential need. But right now, like I said, we're well positioned and well prepared if we're going to have an increase in that. The next slide is one we've been showing you, but again, this is again above the line. On this slide shows the number of active cases. That's really what we have to deal with right now. We were up +4 on active cases is all, from 163 to 167, and we did have 4 more recoveries, so we've got 105 people that have recovered. And so that is, again, positive news in terms of, we talk about flattening the curve. We are absolutely, the curve hasn't even started heading up yet in North Dakota. We've been basically as percentage of positives and this, slight creeping up of active cases. Again, we like the trend lines that we're at. And so that part is the good news. We continue to hear questions about testing and are we doing enough? And again, the key measure of where we have hotspots or not is the number of positive cases divided by the number of tests. And we're showing that here by county. And you can see on this slide that Montreal County, Oliver County, Dunn County, Burke County, all of those are, or Grant County, those are all shaded a little darker. Those are all at 5% or more in terms of positives in those counties per test completed. Cass County at 4.3 is slightly above that rolling average, and Grand Forks County, which has at least so far had a low number of positives, is down at 1.3%. Continues to be very low up in Grand Forks, but on an absolute number, because of the highest population in the state is in Cass County, our most populous county by far. That's where we'll have the absolute most number of cases, but as a percentage of population, it's not considered a hotspot compared to other counties. And we are, again, as we dial up our capability, which we practiced last weekend in terms of being able to do testing. We will be this weekend conducting some testing which in some of our hotspot areas to try to make sure that we're really able to identify and then do the appropriate targeted isolation and quarantine to slow the spread in those areas where we're showing a high percentage. The next topic is not related to COVID, but it's an important briefing which we wanted to bring up, which is spring. We're fortunate that we haven't had massive spring flooding happening at exactly the same time. We were doing planning starting back in December because of the high probability of flooding, particularly in the eastern third of the state. And we've just recently announced that I-29 is closed in both directions between the Manville exit, which is by Grafton and just north of Grand Forks. So there's over 20 miles in both lanes that are closed. If you haven't downloaded your ND Roads app from the North Dakota Department of Transportation, it's a great little mobile app you can have on your phone, which will indicate in those red lines that those are closed. I do believe that there is a route around there, again, for if you're out doing essential travel where you can get on Highway 81. It takes you a little longer, but you can do a loop around and end up getting back on the open portion of the interstate north of where it is closed. Next up, we want to talk about child care. And we gave an executive order back March 26th because, again, keeping everybody working in our state, it was important that we keep the child care sector going in our state. 71%, as you see on this slide, of North Dakota children aged 0 to 5 have both parents that are in the workforce. 78% of children aged 6 to 12 have got all parents in the workforce. So as would be expected in a state like ours, where it had very low unemployment till a month ago, and a vast majority of families had 2 working parents with the high workforce participation and the strong work ethic in our state. So not surprising. And child care in North Dakota, unlike K through 12, gets enormous support from government. Higher education gets a lot of support from government. Childcare, not so much. Childcare is largely the over 1,600 organizations that deliver child care in their state are largely small business owners, privately run organizations, but they are essential services. So we did put together a child care emergency operating grant to help and sustain the North Dakota's vital child care sector during this time. We also announced modified operating guidance for child care providers that aligned with the CDC and Department of Health, and that guidance dealt with daily health screenings, how to maintain clean environments, how to manage meals and play at the right distance, supporting safe distancing by limiting groups, rearranging physical space, modifying activities, and requiring them to have in those smaller groups meant essentially that we were requiring them to increase their costs because they had to have more staff per number of children cared for. Our goals remain the same, which is support the health and safety of children, family, and child care providers. Number two, assure that healthcare professionals and other lifeline workers who are also parents have access to quality and safe licensed child care as they continue to provide their essential services during this pandemic. And three was to sustain the state's child care industry, which is vital to supporting workforce now, but will be certainly essential as our state recovers from the pandemic. So today I signed an executive order that formalizes the modified operating guidance and the emergency grant program that we had discussed earlier. And this includes lifting and cutting through some red tape related to licensure and operating requirements, while still maintaining the safety of all those children, but it does allow these organizations to conform with the mitigation measures issued by the CDC and our state health department. And then last week, I want to thank the State Emergency Commission. The Emergency Commission is made up of the House and Senate majority leaders and the House and Senate appropriations chairs, along with the Secretary of State and myself, and that six-person body approved unanimously to establish the grant program for child care providers with $36 million that has become available in federal funds through the Federal CARES Act. So I want to thank those House and Senate majority leaders and the appropriate chairs, Secretary of State, for their approval on the Emergency Commission. Today we issued the first payments that went out the door to licensed and self-declared. That's another description of licensing, but they're also licensed, but to licensed child care providers in North Dakota who applied for North Dakota's child care emergency operating grants, and 572 participating licensed care providers received payments today. And again, while those payments may seem small on a per child basis, this could be the difference between them being able to stay open or have to close. And again, only programs that continue to be open and serve children with the priority of those whose parents are vital service workers, and then they meet those two criteria and they apply, those are the ones that received a payment. So if you're out there, you're open, and you're serving children of vital service workers, encourage you to apply for this program. And again, great work. I want to thank Chris Jones and his team, Jessica Thomason, and all those that work diligently to do all the work, both on the federal side, the state side, to put together this program, and want to thank those child care operators, those entrepreneurs that are out there that have been providing child care during this really challenging time. For those that are meeting this criteria but haven't applied, it's not too late. If you're a licensed child care provider, it's still time to apply. And again, this is an opt-in for child care centers, so it's not mandatory, but it's an opt-in to apply for the child care emergency operating grants. And so with that, under this timeline, we said the modified operating practice take place March 30, and the first child care operating grants would be made today, April 10th. So we are on schedule and on time with what we had announced earlier. If you want more information, you can go to the Human Services website at www.nd.gov/DHS, click on the COVID button, and details are in the provider resources area. We got another executive order today, and this is an amendment to a prior executive order related to isolation and quarantine for family and household members when someone in the household tests positive for COVID-19. This change is driven by some new, more specific and slightly, in some cases, more flexible guidance from the CDC. And I'll invite State Health Officer Mylynn Tufte to come up to talk about this. Mylynn?
Thank you, Governor Burgum. On April 6th, the governor issued an executive order 2020-21 regarding quarantine for individuals who test positive and as well as for their family and household members. On Wednesday, through a state health officer order, I expanded the executive order to clarify the length of quarantine for individuals who test positive and to include immediate isolation upon notification for at least 7 days after the onset of symptoms and 72 hours after becoming fever-free with symptom improvement. Today, I'm issuing a state health officer order to expand on the executive order that was mentioned to allow for exemptions for essential workforce. And for family and household contacts of individuals who test positive for COVID-19. Household contact is considered residents in the same household or residential premises. Like our other orders, the individuals who are exempt from this order include essential critical infrastructure workers as defined by the United States Department of Homeland Security. Employers should follow the CDC guidelines that were updated this week to implement safety practices for employees who've had exposure to a person or suspected person that had COVID-19. These include pre-screening temperatures and assessing for symptoms prior to letting them start work. Having the person wear a face mask at all times while in the workplace for 14 days after the last exposure. Maintaining 6 feet and practicing social distancing as work duties permit. Routinely cleaning and disinfecting all areas such as offices, bathrooms, common areas, and shared electronic equipment. Should an employee become sick during the day, they should be sent home immediately, and surfaces in their workplace should be cleaned and disinfected. These CDC guidelines, as well as the state health officer order, can be found at our website, health.nd.gov. In addition to the order, our recommendation for all close contacts remains the same. If you can stay home, please do for 14 days past the last day that you were in contact with a person who tested positive. Having people self-isolate and remain apart whenever possible is one of the best ways that we're going to stop the spread of this disease and return to normal. Thank you.
Thank you, Mylynn. And thank you and thank everybody at the Department of Health for all their incredible work they're doing. For the media that's here, and for those that are home that are following this, as we learn new words, we want to provide some clarification that we're going to be using going forward on isolation versus quarantine. So this is just, what do you call it? This is called Webster's Dictionary moment. Isolation. When a person is showing symptoms or is tested positive of a disease and they separate themselves from other people to prevent spreading the disease to others, that's isolation. So if you've got it or showing symptoms, you think you're positive, you presume positive, you put yourself in isolation. Quarantine, that's when you're a person who is exposed to the disease through close contact, but you do not yet have symptoms, but you separate themselves from others for a period of time to prevent potentially spreading the disease to others. So that's why, again, when we're talking about isolation versus quarantine, again, this 14 days of quarantine would be from the last time an individual was exposed to a case while the case was contagious. Those definitions will be available on health.nd.gov, but for those that are that are quarantining. Again, we thank you because that kind of targeted, disciplined individual responsibility is helping us slow the spread. And of course, people that are in isolation should be in isolation because those are people that know they have it or waiting for the test or have tested positive or symptomatic. So thank you both. If you're either in isolation or quarantining, we say thank you because you're the heroes that are helping slow the spread. Next topic, housing. You know, during this emergency, it becomes more important than ever. But even without the emergency, we know that one of the fundamentals of health is access to safe and stable housing. And it's challenging during periods of whenever we have an economic downturn. We see increases in the amount of people accessing shelters. We see increases in the amount of homelessness. And so when this whole economic downturn started, one of the things we did is we put together a work group from Department of Human Services, the Governor's Office, from Department of Commerce, Department of Labor, Department of Health, Housing Finance Agency, B&D, and others to make sure that we were working on housing in a comprehensive way, whether it's homeowners with mortgages, people that rent, or people who are at the risk of becoming homeless. I'd now like to invite our DHS Executive Director, Chris Jones, to come up and share progress on one of those components of the housing work group, which relates to homelessness. Chris?
Thank you, Governor. First, I think just to understand the need. I think we've heard a lot about talk about working from home, staying at home, but that presupposes that you have a home. We've also talked a lot about washing our hands, but that presupposes you have access to clean water. If we don't have access to safe, affordable housing, we can't meet two of the criteria to prevent the spread of this virus. So working together, the housing team has been working together to make sure North Dakota has a good strategy for addressing housing and homeless needs that have been exacerbated by the COVID emergency. We are working together with local private sector partners to help people who are experiencing housing crisis find their way through it. This oftentimes can be very difficult. And with the private sector housing market to do what we can to help ensure that the housing market in North Dakota will be strong and ready to serve not only during the COVID emergency, but well beyond. It is essential that we pay attention to housing if we want to continue to grow North Dakota's economy. In addition to directing resources to the existing local infrastructure that exists in North Dakota, whether that be homelessness, unstable or unsafe housing situations, or possibly eviction, stay stably housed. As federal funds start to flow into North Dakota to help ensure we can address the needs of our state, these agencies that the governor previously mentioned, along with our local and private partners, are working together to ensure these increased dollars are put to use effectively. So how are we addressing this during the COVID emergency? We want to make sure that people who need to be quarantined due to COVID exposure have a safe place to lay their head at night. Additionally, we want to make sure that anyone who is COVID-19 positive and experiencing homelessness will have a safe place. And we recognize how important it is for people who are unsheltered and living in a car or on the streets to have access to shelter for all of the reasons mentioned above. Through the newly formed State Interagency Task Force on Homelessness, Domestic Violence, and Food Insecurity, we have established safe housing options for individuals who are currently homeless and unsheltered, victims of domestic violence, and individuals and families who need to be quarantined or isolated due to COVID-19. Starting next week, these units will be available across the state and will be coordinated among existing shelters and providers, the Department of Human Services, the Department of Health, and many other supporting agencies, providers, and programs. But I think it's important we realize that we are building for the future. And by having a coordinated effort to help people stay or become stably housed, we are also preventing homelessness and relieving some of the pressure that the state's homeless shelters are experiencing as they continue to operate at capacity. We are committed to not doing anything today that doesn't contribute to our long-term success as a state. and we are working hard to make sure any new initiatives we support are well thought out, well monitored, and targeted to meet specific identified North Dakota needs. April is Fair Housing Month, and today we received a letter from Ben Carson, the Secretary for Housing and Urban Development, to remind us the principles that underlie our nation's commitment to fair housing. I wanted to read an excerpt from his statement as I think it serves as a good reminder for all of us. The Fair Housing Act embodies the spirit of this great nation, where everyone is entitled to equal opportunity and respect. We need to be attentive to the heightened protections and needs of family, friends, and neighbors who are older, who have disabilities, or pre-existing medical conditions. We also need to honor and support the medical professionals and caregivers who selflessly go to the front line to serve and heal, and we must be creative and compassionate to keep each other safely sheltered, healthy, and prepared. Right now, in the spirit of fair housing, we need to be the best neighbors we can for one another. We are very grateful to all the local organizations who help deliver much needed economic stabilization to North Dakota residents every day, from community action agencies to homeless shelter providers and to human service zones. In the coming days and weeks, you can find more information on housing and homelessness at ndresponse.gov, including more details on the state's specific responses to the housing issues facing families across the state. Thank you.
Thank you, Chris. I want to just put some additional remarks on this. We've had, again, when we're in a health emergency, it's easy to focus on the health aspects. So I know in our major markets, we've had a lot of attention paid, including front page stories on the paper of cots in gymnasiums, with this vision that somehow we might end up like McCormick Place or the Javits Center in New York, where we're going to be trying to do minimal care facilities. We're doing everything in our power to make sure that doesn't happen. And North Dakotans are stepping up with individual responsibility, and that individual responsibility is showing in the numbers. And at least so far, we don't see any plans where we would be in anywhere in the near term or near future be accessing that. But there is a reality that there's another shelter that is not on the front page that could end up becoming overwhelmed, and that's our domestic violence shelters, our homeless shelters, places where people might seek refuge when they've lost their housing due to economic hardship. And that's what Chris and the team are really working on, is the one that exists today, often invisible to many people in North Dakota, the people that are moving in and out. Often we think of homelessness maybe as a chronic condition that is the responsibility of that individual, but reality, homelessness, there's churn in homelessness. People become homeless for a month or two until they find a new situation. Maybe it's more prolonged, but this is, again, we also know that there can be overlap between addiction, mental health, behavioral health, can all overlap with housing or lack of housing, and this is all compounded during periods of time when we have a big drop in economic activity, which is we're in right now. We've basically had the bottom fallout of our economy in a way that is never been seen, not even in the 1930s. And so I'm super happy that the team is proactive, and I'm super happy that they're working on a comprehensive plan, and the plans that are being put forth could also be, again, will include the private sector and nonprofits. And so again, when we have this federal money coming in that are at state's discretion to use, we've got an opportunity to be able to support those nonprofits and the private sector that is providing housing, to make sure that we have we're, again, by spending dollars, we're saving dollars, because just like if you can prevent someone from starting smoking when they're young, you prevent medical costs over the rest of your life. If we can prevent homelessness by supporting the existing system today and with wraparound services for people, we can save a lot of money in the long term, and this is what this federal dollars that are being provided to the states help us do this. So again, great job to Chris and team, and we'll look forward as that continues to roll out in the weeks ahead, and as you work with with those providers and those coalitions. Next up on unemployment. We want to give some highlights here, and we won't walk through all the data on this graph, but we did want to make sure that those who are really interested in unemployment data, there's actually a separate website we have not shown before, but it's NDLMI, which is North Dakota Labor Market Index.com. This is populated by all the data that comes from North Dakota Job Service, and you can find most of the things that you're looking for and the questions that we might have there. But I do want to highlight that since March 16th, we've now processed over 45,497 claims. We've accepted just under 4,000 pandemic unemployment assistance, and this is for individuals not eligible for regular extended benefits, including independent contractors, self-employed, and gig workers. So people are hearing about that, and that's a great safety net. And then the pandemic emergency unemployment compensation, this is the one that provides additional 13 weeks of benefits for individuals that may have exhausted all their rights to state unemployment. And this will primarily assist those individuals who might have been seasonal workers laid off in the fall, who have used up all their benefits, but due to the pandemic are not being called back to work. 37 and 30 have applied for that. And then we've heard a lot 2 weeks ago about the additional $600 that check that we give into each individual for unemployment insurance benefit made on top of their regular unemployment insurance, and that is the federal pandemic unemployment compensation, and the job service is in the process of implementing that. And a few highlights, over 20 million in benefit payments have gone out the door. We also appreciate people's patience. There have been a lot of calls. Again, encourage people to check the website for the frequently asked questions, because you might be able to get all of your questions answered there. But if you do choose to call, you might have to wait. The average wait time has been just slightly under 14 minutes. That average means some might be longer than that, some might be faster than that. But we do know that with the record number of unemployment claims coming around the country, that our hardworking team, which has been backed up with extra staff, is one of the lowest, if not the lowest, wait time in the nation right now at that 14-minute average. So thank you for your patience if you're calling, but check the website first. And then that team over there that has now done more than 2 years of claims in the last 2 weeks, they've processed or adjudicated 14,451 issues that come up on unemployment claims, and they've worked that backlog all the way down to just under 4,000. But again, thank you for the hard work that everybody is doing over there. It's really been amazing. They've processed over 64,000 weekly certifications, and on and on and on. The work that they did to do the mainframe and other technology program changes, that was completed, and we were able to eliminate that waiting week. So the system now, we can waive that, was completed on April 7th. Payments were being made on April 8th. So more good news there. And again, thank you to that whole team. But we do have people that have been working nights and weekends, and I'm sure they'll continue to work over the weekend. Also want to thank the NDIT team and the Job Service NDIT programmers that have been working days and nights to keep coding and keep the mainframe going over there. So thank you to that entire team. Again, questions on any of that, jobsnd.com, which is preferred if you can check the website before calling. In closing today, a couple things. One is I want to talk about the CARE 19 app. As you know, this is continued to roll out across the country. We've had over close to 14,000 downloads, 22,000 place visits have been logged so far, and again, that continues to show additional interest from lots of other states. I think the developer of this app has been contacted by 16 other states. And then earlier today, there was a major announcement that Apple and Google, who generally are competitors, are teaming up to work on an app that would help an individual identify whether or not you're associated or close contact with someone who's positive. That app is scheduled to be out in May. Unlike the Care19 app, I'm sure that will raise even more questions about privacy. But the Care19 app, which is anonymous, opt-in, you control the data, no sign-in, is a great way that you can help on the whole aspect of contact tracing. And perhaps now that, again, great that North Dakota was on the very front edge of this, of any of the states, and nice to see the major technology companies jumping in, because, again, technology and location may be one of the tools that will help us get to a new normal. In closing, today, I want to, again, go over the quick reminder as we head into the holiday weekend about ND Smart. Same guidance we've given everybody before. The team in the room has heard this dozens of times, but it turns out we've got new viewers that are watching every day. Thank you for tuning in on Good Friday. If today is a holiday and maybe the first time you're watching, under North Dakota Smart, we talk about staying home, staying healthy, and staying connected. And those basics include great hand hygiene. It includes only essential travel. We talked before about when you do shop, all the guidelines for that. One person, plan ahead, order if you can. We also, are talking about, covering your cough. If you got symptoms at all, please stay at home. And, disinfect and clean services. And if you do get out, whether it's for a walk or anything this weekend, make sure you maintain proper distance. And again, always also a good idea to wear a mask to protect yourself and protect others. So thank you for following this pragmatic guidance, which really relies on your individual responsibility, which we know we have a lot of in North Dakota. That's the nature and the character of North Dakotans, is that individual responsibility. It's certainly something we take pride in and can be proud of, because I just want to say you're doing a great job. Way to go, North Dakota. Keep up the great work. And as we close with a little gratitude right now, and maybe some more at the end after questions, but right now I want to give a special shout out to all the young people in North Dakota. One of the things that's been a fun bright spot in this job is all of the fun letters and notes and stuff we're getting from school kids around the state. And I want to give a shout out to a couple siblings actually that sent these in, and so they'll recognize them, but one says great, the other one says North Dakota Smart. So I want to say thanks to all of these guys, but I got to read this one on North Dakota Smart. This comes from Addison, age 11. Talking about thank you for keeping us safe, and he's got safe, secure, and fearless every day. So and that's a really fun little acronym for safe, secure, and fearless. Great for North Dakotans to keep in mind. And then we've also have from Ava 8 talking about thank you for keeping us safe. Appreciate everything you do for me in the world, but COVID-19, you're a gem. Anyway, these are little bright spots. The First Lady and I are getting some of these in, and I want to just say thank you to these kids, because we know that the kids are out there. They're doing great work every day, keeping up with their homework. Homework's an everyday thing right now with distance learning, but I'm sure they're also playing a role, keeping in touch with their grandparents, keeping their parents happy, doing more chores than maybe they had to do before. Life's changed for everybody, but to all the youth in North Dakota, I want to give a special thank you to you for your important work that you're doing to help keep you, your parents, and your grandparents safe. And thanks for for helping to be North Dakota Smart. We appreciate all that, and we know that future's good hands with the youth of North Dakota. With that, we'll stand for Good Friday questions. Jack had his hand up first, all the way back. Jack Dura, Bismarck.
Governor, can you talk a bit more about the testing plans for Montreal County? Is that set to do that strike team approach in Montreal County?
The answer is yes, and our plan for tomorrow is the communications are going to be driven locally versus from this podium to help us make sure that we're targeting all the people in that hot spot that we're trying to reach, versus it becoming a regional event. So both the National Guard, the Health Department, the tribal leaders, county officials, everybody has said, let us handle the communications locally. So we're not going to be any more specific than that. But as you saw on the slide, it's one of the areas where we got a high percentage of positives, and we're heading there. The other thing, which again, we're also not really announcing, but we are doing, the strike team has been working on situations where if we end up with one positive in a long-term care facility, I think we're up to at least 3 that I know of where we have made come in and organized with the Department of Health, the state, one of the state doctors, epidemiology. We design plans, based on the physical layout of the building, and we come in, we test patients or not residents, we test staff, and we create isolation. And again, working hard to in these instances where we get, because this is the skill set we have to have is find a positive. Do great contact tracing, do the isolation, and do the quarantining, and that's going to help us slow the spread. Lane, and then one online.
Governor, first I just want to say thank you to you and the team for the little Easter presents. That's appreciated. The question is, the DOT has moved most of their services online, but they are prohibiting people from ages 65 and older from using those. But the ages 65 and older are the ones most susceptible to this virus. What is there that can be done for those that want to renew their driver's licenses and such?
That's a new one to me. I did not know about that one, so I'll have to check. I knew about the first part. I knew we were moving stuff online. I knew that they'd completely eliminated the backlog, and we'd completed over 350 CDL driver's tests under the new standard operating, CDL meaning commercial driver's license, on-road testing with the examiners wearing masks, the drivers wearing masks. So I knew they were doing a lot of great work. I did not know about the age limit. I'll have to have my team check on that one. Okay, so maybe they'll have an answer before the end of this, but we'll find out. Hadn't heard that one. Question online?
Robin Travers of 660 KYZ in Williston. What do you and your team need to see in the data to deem it safe to open businesses and potentially schools on April 20th?
What we need to see is not just in the data, in our data. We'd also have to understand the data of what's happening in the states around us, what's happening in the country. There's a lot of factors that would go into that, because again, our objective here is to try to find that balance where we want to keep people safe, and then we want to figure out, how we open up. As I said, when we do open up, whatever date that's on, it's not going to open up the way we close down. We close down very quickly. When we open it up, it's going to be turning the spigot on slowly. We said that we would, by next Wednesday, provide guidance next Wednesday, April 15th, on whether or not we would extend that from April 20th to further. And I don't want to be I want to be positive, but I don't want to be overly optimistic or overly encouraging, because back many states thought that they would be on the downswing by April 20th, and our line is so flat that we haven't even started up yet. And so we may have a flatter, longer curve, and then we're going to have to evaluate that versus what was earlier thought to be, a quicker, steeper curve. And again, that'll take some thought on how to do that. I said all along, it's going to take it's going to be more complex and more challenging to think about how to open up than it was to how to close down. I mean, because opening up, the possibility if we don't have widespread testing, you could be, and if you said, hey, we got 760,000 people in our state, and even if you multiply by 10 and say there's 10 positives out there for everyone we've tested, and you end up with a small percentage of the people who've been positive, and you open things wide up, we could have the whole thing we've been trying to avoid, which is we could have a huge crunch of positives, which would then tax our health system. And so we want to manage this from beginning to end. We don't just want to defer a crisis for a month. And so without a cure and without widespread testing, there's a lot of unknowns. And I would say, just from a pure forecasting and modeling standpoint, there's much more certainty about what's going to happen in the next week than there is going to be what's going to happen in May or June. I mean, the further you go out, the increased amount of uncertainty. But we'll know a lot more by Wednesday, because we're going to start to see whether these curves have flattened in other states, and whether or not maybe we can avoid the peak altogether. But stay tuned for April 15th. Thanks, Robin, for the question. Jacob, and then Jacob, then Dave.
If I may follow up on that question, then you've repeatedly said that we should assume that the cases are about tenfold what the data says, without knowing, with the line as flat as it is, what's the likelihood that we're going to hit a peak and not have the data to show it?
Well, I would say that there's a very, given the time frame of when the serology testing, meaning the finger prick kind of testing, where suddenly instead of testing, we get excited when we do 600 or 800 tests a day. What we really need to have people back to work is being able to test a large percentage of the population in North Dakota, and then people might have to be tested multiple times. I mean, if you're trying to get people back to work in a factory situation, you're trying to get people to attend a stadium full of people, you might be in a situation where you're testing to make sure you've got screening to make sure that you're not reintroducing a pandemic that is, again, highly contagious, highly contagious. I mean, models are shifting all around us. When I talked to Governor Walsh last night, the new Minnesota model actually increased their R0. That's the rate of infection. They've increased in their model to a 4, which would mean that for every one person that gets it, they can transfer it to 4 other people. We've been through this math before. When it was at 2, that's 2 to 4 to 8 to 16 to 32. If it's 4, it's 4 to 16 to 32 to 64 to 120. I mean, you're skipping steps along the way. It's not, I mean, that's for the 2. On the 4, it goes 4, 16, 64, 256, 1,028. I mean, you're doubling even more logarithmically. So anyway, it's very, there'll be a lot of challenging decisions made going forward, given the fact that we've had so few cases so far. I mean, it's great news we have a flat line, but that doesn't tell us that wow, it's never going to come here. It just might be coming later here. Dave, you're next.
Yes, and this follows along with that, too. Governor Walz has had some pushback from some legislative leaders saying they were hoping they were going to relax these rules he had earlier. And I was just curious, have you gotten any response from legislative leaders here? Are they pushing back at all, or have they tried, or are they accepting what's going on in terms of business openings?
Well, over the last 2 days, we've had calls with the House and Senate leaders from both parties. So as in North Dakota, we're all on a first name basis. So Josh and Joan and Chet and Rich, and we always get good suggestions and ideas, and they're constantly polling information from their caucuses. So we really value those calls, and we value the input. Individually, our staff hears regularly from legislators. We got a very open channels of communication with all of them, and I would say that we hear both sides, just like we do from the population. We hear some people that hey, when are we going to open up? Can't we open up sooner? We hear others that are saying, hey, are you sure you're doing enough? And that's okay. We love the diversity of opinions because I think our legislature represents the diversity of the opinions in the state, and they're representing their constituents. So we appreciate that and value that. I would say that again, the challenge for us in North Dakota will be when other states that their curve, their peak may have already passed and clearly have passed, and they'll have the data from thousands of cases that they're on the way down. They will start opening up, and we may not be in a position, whether it's us and a few states around us, we may be in a position where we're still climbing and they're declining. As it's been said many times at the federal level, there's not one curve for the United States. There's curves for each, region or state. And so it'll be very difficult and challenging communication to explain to people, why we're still closed down when, say, New York is starting to open up, or why Louisiana is opening up. If they can open up, why not us? Well, it's going to be because our timing is different on these things. But like I said, each day, the models get better every day because each day you've got more actual data to either prove or disprove whether your forecast and your curves are accurate. Back to, let's see, I think I'm going Lane, then online, then Jack, and then Jacob, if I can remember that far ahead. Let's say.
This is actually for Mylin.
Okay, fantastic. Thank you. Mylin, come on up.
So the other day I had mentioned there was a daycare that had contacted us about them having providers that have tested positive for COVID-19. They contacted us again and said that they have tried contacting the Department of Health and have gotten no response, and are trying to wonder what they can do to properly clean their site, and if they're allowed to know that if any of the children have tested positive as well. Just numbers, not names for the kids.
Okay. So on that specific example, I'd like to get the information so that we could reach out to them. I'm not aware of that. I know that we have had some incidents with daycares, and even yesterday there was a lot of focus testing that was done here in this community to help protect the children at daycares as well as the healthcare workers. So I'm sorry to hear that. And if you share that information, we'll take care of it and really check it out.
And Lane, related to that, is that the same daycare that you mentioned in a question earlier this week? Okay, I would say on that one, I do know that there was a well-coordinated effort between local health officials, state health officials, City of Bismarck. They tested all the staff, tested a number of the kids that were in that daycare, and that was all done. It actually had been done the afternoon that you asked me the question. I just hadn't been briefed on it. So again, we'll keep tracking that one down, but I know there's already been work done in that area, and we appreciate the provider and everybody locally and coordinating with us to do that. That's the kind of swift action we're looking for, is to get in and do that. But the cleaning side and the reopening, Mylin and Chris Jones is still here because child care is managed under the Human Services, and so we'll get Mylin and Chris in contact with them. Okay, Danny?
Question for Chris Jones.
Yay, Chris Jones, he is here.
Matt Henson with WDAY in Fargo. Regarding shelter for homeless or victims of domestic violence, where should they go, and will they be given a voucher for a hotel? And then also, what about people who live in an apartment and have nowhere else to go to isolate?
Sure. So as it relates to what we're calling our scattered shelter plan, we are looking at using hotel vouchers specifically for that. One, to relieve pressure on the capacity in current homeless shelters, and for those that need quarantining. And so the process will be posted early next week on how that will go, and it will be organized through the local homeless shelters. It won't be managed necessarily throughout the state. It's going to be with those community partners, number one. As it relates to eviction prevention, we also have a plan for that, and we will work through different agency partners, and would ask at this point for those that have questions as it relates to eviction prevention to reach out to the Department of Human Services and Jessica Thomason, and we will get them the information that they need as it relates to that specific. With the eviction prevention strategy that we are putting together, though, what we mentioned earlier is we want to be very targeted in how we're approaching eviction prevention. There are already programs available today that we do not want to supersede or double dip around. And in looking at all the federal programs that are out there as it relates to unemployment and the $1,200 stimulus checks, we are using the same eligibility criteria we use for SNAP, which we believe the eviction prevention, or the pool that would necessarily need to access this program, will be small. But we know there is a segment of the population that will need access to these funds in order for them to remain in their apartment or in their housing situation. So hopefully that answers his question, but most of that information will be coming out also on ND Response next week.
Lane? Is that right, or no? Was it no? No. Oh, no, I'm sorry. No. Okay, I got to go back over here. I think we went you, then online. Okay, then Jack, and then who's next? Dave, then no, Jack, Jacob, Dave. Okay. Jack Durham, Bismarck Tribune.
Curious, Governor, if the state has thought to deploy its emergency management assistance compact to other states with medical personnel, as was done with Hurricane Florence in 2018.
I couldn't quite, neither Lindsay or I could hear you. It could be the effectiveness of your mask, but well.
Does the state plan or has talked about deploying its emergency management assistance compact to other states with medical personnel, as was done for Hurricane Florence in 2018?
I'm sure that our Department of Emergency Services talked about that over the Unified Command, but I haven't been briefed on that, if that's anything that's in the works right now. But we'll put that on our, get back to you, but good question. Thanks, Jack. Okay, so, they're saying they did on the EMAC request. When earlier we talked about the 50,000 masks we sent to Montana, that actually came through an EMAC request. So I guess it has been activated, at least in terms of supplies it was sent, but your question, I think, related to personnel. And so we can follow up on the personnel side. Informally, I would say I think I shared we had the call with Wyoming, South Dakota, and Montana governors. We all talked to each other and said we would continue to try to support each other here in the region as good neighbors. And as I said, had a great call with Governor Walz yesterday. Talked about and explained to him that when we're doing the planning that we're doing for the hospital planning, which we'll talk about next week, and the surge planning, that we're really in our planning including all those northwestern Minnesota counties as part of the North Dakota plan, because those people in those counties would be receiving health care from either Altru or Sanford, and if you ended up at Sanford in Bemidji and you said, hey, you need another level of care, someone might be transferred from Bemidji to Fargo. So that is all, so with Essentia, Altru, everything. And we also talked about, too, with Governor Walz's understanding that because of the way pharmacy laws are in North Dakota, a Walgreens in East Grand Forks and in Moorhead do sell drugs, and perhaps a lot of them, the North Dakotans that go across to get their prescriptions filled at either at a Walgreens or Walmart in Minnesota. So we've got pharmacies on one side, we got hospitals on other. In Breckenridge, it's flipped, where the hospital for Wahpeton is in Breckenridge. And so as he and I talked about it, these are communities where we have to really make sure that the border's invisible because we have to care for people on both sides, and we're planning there. And we also talked about, is there other areas of potential collaboration between North Dakota and Minnesota when it comes to the widespread serology testing. And so we'll continue to stay in regular contact to see if there's ways we can work together for the benefit of the citizens of both our states who live and work across a virtually invisible border for most of the time, whether if you're a nurse living in Minnesota and working at a Fargo or Grand Forks hospital, or if you're a nurse living in Wahpeton that works in Breckenridge. School teachers, people are moving back and forth and probably never spend a minute thinking that they're crossing the border multiple times a day as part of that, and we got to keep it that way. Jacob?
Governor, we've confirmed that a church in Dickinson will be holding in-person services this weekend. Wondering if you had a message for them and if they may face legal repercussions for doing so.
Well, as I said in my opening remarks, I mean, our country was founded on freedom of religion. We've gotten guidelines, asking people to, to practice safe distancing, use innovative approaches, and to keep with groups less than 10. But there's going to be no legal action taken against anyone that would decide to hold a service. But again, I would encourage people to think, particularly if they, as part of those operating procedures, they may think about those that are, those individuals that are at risk, either because of age or underlying conditions, might want to dial in for that service versus show up. Because as I said, we do have cases in North Dakota where there have been a cluster of double-digit cases that have all been traced back to one congregation. We know that from other states, whether it's funerals or church services, this is a place where you've got vulnerable populations sitting close to each other. So it's a high-risk activity that we're hoping that people would follow the guidelines, but we also understand and respect what this country was based on. But each individual that belongs to that, I would also, because of the individual rights in our country, each individual should make a decision about whether they want to place themselves or their loved ones in a potential risk situation as well. So back to individual responsibility.